Welcome. My name's Tom Stark, and this is the NAMI Santa Fe Information Talk. We are absolutely delighted tonight to have Dr. Kristina Sowar, MD and Associate Professor from the Department of Child and Adolescent Psychology at UNM. And we're even more delighted that she's going to talk about how COVID-19 endangers our mental well-being. And the flyer we sent out had information on her, but I always like to let the speakers introduce themselves because they seem to know much more about themselves than I do, and they usually do a better job at it. So with that, I would like to turn the talk over to Dr. Sowar, and she will talk for about 30 minutes, and then we'll have another 30 minutes where the audience is welcome to ask questions as they like. So, Dr. Sowar, over to you.
Thank you so much. Thank you, Mr. Stark. Good evening, everyone. It is a pleasure to be here. I'm grateful to join you all this evening virtually. So I am eager to have the opportunity to discuss with you more conversation. Please do let me know, though, if there's Zoom issues, like screen is freezing or anything like that. My Wi-Fi should be good. And I do have small children, so they are a little away from our room, but if you hear any background noise, I apologize in advance. It's a little bit lively in the evenings. Okay. All right, so let me go ahead and share this presentation, if I can just move. Okay, so yeah, I wanted to touch on kind of the mental health effects of COVID, both the detrimental concerns and then thinking a little bit about resiliency and coping towards the end. So I do not have any relevant financial disclosures. I'm really grateful to you all for joining. I'm grateful to NAMI for supporting the talk and having me, and also to UNM for the work there. And we talked about the format for the conversation tonight. Okay, so the plan that I have is to start with an overview of the intersection of COVID and mental health, talking a little bit about that, and then look at some of the data that's been published on specific effects of COVID on, particular individuals in our society, globally, and then thinking about kind of relative age groups or populations and how they might be affected more so. And then spend some time at the end talking about resiliency strategies, or really thinking about like how we can support one another and coping kind of as the pandemic, shifts and changes, but is still present. Okay. And then, some of anchoring into why I think this is a really valuable talk is the attention that has been paid towards mental health during the pandemic, or at least, some of the increased publicity and just conversation around mental health, hopefully is a positive in thinking about how we kind of normalize or validate the stress and the associated mental health impacts that has on people. And, to think about kind of as a community, how we can continue to build support networks or solidarity in this realm. And then, for the state of New Mexico as well, but just our local communities, how can we be thinking about what's happening and where efforts are being made towards responding or preventing further challenges too. Okay. So this infographic I thought was a nice just summary of the many things that we think about. Again, I know a lot of the content in this conversation is not necessarily new scientific groundbreaking evidence, right? A lot of it are things that we talk about day in and day out, but just trying to link them with mental health. So at the bottom, we think about some of the social distancing that all of us have experienced this year. And for some people, in ways, there's been some positives to that, right? Some people like having less realms about the mental health impacts of COVID. You can kind of think about it in different layers. So, right, there's thinking about people who have had COVID, the actual infection and the secondary effects from the infection. So we're learning more and more about how COVID and the virus itself affects the brain, affects some of our, cognitive functioning and things like mood, and what they're looking at in terms of people who have had COVID and now have these post-COVID or long haul syndrome symptoms, and where mental health falls into that. And then kind of around the viral effects itself, the anxiety about getting sick, or the virus, concerns about getting sick again, or things like that, that can come up around that. And then relevant both to those pieces for us as individuals, but also for those people that have lost loved ones, that have lost other, connections or really important life experiences, that there is so much grief and loss that's come about through COVID. And, that can have pretty significant impacts. And then, as mentioned in the last slide, right, all of these changes, restrictions, adaptations, so many different things that we've come to see life as with COVID, can have had, I think, a lot of impacts in terms of stress, and in how people are coping and functioning. Okay. All right. So I just want to share then a little bit of data on what's been being studied as far as how the actual virus affects the brain. So there was a recent study that came out looking at some of the molecular cellular changes from people who have had COVID. Now, this was looked at in people who had died of COVID. And so, of course, that's more a subset of severe COVID and not as much mild COVID. But some of the brain changes they saw there that really represented inflammation of the cells, disrupted kind of neuronal circuitry, and things that you might see in individuals with dementia were found, which suggests that COVID potentially, as it crosses the blood-brain barrier, can really have some pretty serious effects on neurons and our nervous system. And then as far as what's reported symptomatically, so not just these pathological studies, but, when you look at symptomatic reports from people with COVID, that many people, up to a third, perhaps even more, who report a range of mental health concerns, from memory issues, this kind of brain fog experience. Depression is one that we're seeing a lot of. And then for people that in the acute phase of illness might have delirium, where they're kind of consciousness, there's some waxing and waning of their ability to attend to and be present. And then there's been reports, actually several reports, of new onset of psychotic disorders after people have had COVID. So they may have had mild or moderate cases that seemingly recovered, but then a month or two later, they developed psychotic experience. And that's not something unheard of with other viruses, right? Sometimes after we have a virus and our immune system jumps into play, you can have post-viral acute things like psychotic syndrome, but it is a pattern that's not been really uncommon in COVID. They're seeing some fair numbers with it. And so this is still really being understood. How does SARS-CoV really affect the neurons specifically? Okay. So then I'm going to spend maybe 10 minutes here looking at data. And a lot of this is relevant to kind of how particular populations of individuals have been affected. And I want to kind of honor the fact that I try to be careful about generalizing or labeling that, these data apply to everyone who may identify in these categories, but just to kind of get trends and see what's been studied. I'm sorry. So the CDC has done several arms of research. So one was looking at data comparing mental health reports from adults in 2019 to a similar period of time in 2020 in June. So 2019 being kind of early in the pandemic, 2019 being pre-pandemic, 2020 June being kind of early on in the process. So between these 2 years, there was a significant increase in June 2020 in adverse mental health conditions in people that were reporting substance use and suicidal ideation. The numbers from the population were basically that you were seeing 3 times higher rates of anxiety and 4 times the rate of depression amongst the adult population. And that when you broke it down and looked specifically, it was young adults more so affected than older individuals. Looking at racial and ethnic minority or identification here, that people who were Hispanic and non-Hispanic Black individuals were reporting higher rates of anxiety and depression. People who were unpaid caregivers, basically implying parents or those taking care of their own parents, were struggling more, and people with pre-existing mental health conditions, right? Either some exacerbation there or potentially additional stress that was difficult. So I'm going to go to one study and then come back to more breakdown on these. There was a recent article in The Lancet, one of the major British journals, that was looking at depression and anxiety disorders globally in 2020. So it was really looking at the burden of depressive and anxiety disorders in many, a couple hundred countries and territories in 2020. So this was a huge number of people, many studies that they collaborated, and they were looking at rates of depression and anxiety, that had been measured and diagnosed, and then also what were the factors associated with those. So they showed that there, in general, globally, was an increase in the prevalence or the incidence of depression and anxiety in 2020. At the bottom there, what I mentioned is that what they approximate or really took away from the grouping of studies was that approximately 50 million new cases of depression globally, somewhere between 50 and 100 million of anxiety disorders. And that the most common connections or the factors that were correlated with worse symptoms. So when people were in countries with higher infection rates, and if they were had a higher reduction in their mobility, right, kind of reflecting like more restriction, that those were both associated with higher rates of anxiety and depression, and that in general, females were more affected than males, and again, younger people more than older. So these data, I'm going to move through kind of quickly, but, happy to, again, share the slides and let people look more at these. So this is looking, now coming back to the US, at a breakdown during 2020, I think up to February of 2021, at the share of adults who were reporting symptoms of anxiety or depression during COVID. So you can see that it's 30+% with anxiety, a little less with depression, and then a fair amount with both. Now, these didn't have to meet full criteria for a major anxiety or depressive disorder, but had to be, significant number of symptoms of both. This is looking at age. So of the people reporting anxiety or depressive disorder symptoms, what the population was, or how this was breaking down according to age. So as you can see, more so affecting people in the 18 to 24 range, and then kind of decreasing through older ages. And we'll talk more about maybe why that's the case. And then this is looking at adults by household job loss status. So reflecting that when adults were living in a household that they or someone there experienced a job loss, there were certainly higher rates of anxiety or depression happening, which makes sense, the stress and the insecurity, uncertainty with that. This is looking at households with children under 18. So showing that in these households, generally women were more likely to report symptoms of anxiety or depression. But again, it's still a lot of men, so it's not a huge difference. And then this is looking at adults who were reporting significant anxiety or depression during the pandemic by race and ethnicity. I mentioned that non-Hispanic Black and people identifying as Hispanic or Latino were higher in the spectrum. But again, we're still looking somewhere between 30 to 50% of adults in general. Okay. And then this was looking at if you break down by household income. So in people making less than 40,000 as opposed to more than 90,000, that those making less than 40,000 worry or stress had a pretty significant negative impact on their mental health than people that were in the higher income range. And then this is looking at essential and non-essential workers. So essential being the dark blue. And I think this was something commonly talked about, that basically people who have been essential workers and really expected to be on the front lines or, working closely with people throughout the pandemic have had higher ratings of anxiety and depression, including substance use behaviors and suicidal ideation as well. Okay, this is looking at people, like breaking down into many of the factors that we just talked about, really which percentage was which group may have had the highest impact from COVID on their mental health. And I'm sorry, a lot of these are small. This is kind of small graphic here and the numbers are faint. So, I think it's really hard to compare, right? And say like, oh, well, this group preferentially is so much more affected, but it does highlight again that kind of when we think about people who have really struggled during the pandemic and report struggling, it's often younger people, parents in particular, mothers, and then people with, lower income brackets, chronic health conditions as well. Okay. And then showing that, again, there's many people who have been really worried about family members getting sick. There is some difference in this in racial and ethnic background, as well as gender difference. And then this just highlighting that in general, many people felt like they had a negative impact from the coronavirus and struggled to get some of their healthcare needs. So these are all from this KFF site that uses a lot of national data, including from the CDC. All of it's cited on the slides. Like I mentioned, I'll send these to you if people want to spend more time looking at the data or go to the webpage. So that I just wanted to highlight a few of the risk factors we think about, but just to look at the numbers, it's fairly staggering how many people in these surveys and studies report negative effects and symptoms of anxiety and depression that are significantly elevated from the previous years, or just in general, that this is where they stand. So of course, my role doing more work with child and adolescents at UNM wanted to spend a few minutes thinking about youth and how they've been affected. And so some of the pieces we think about are, how are children affected because of their developmental status? How are they affected by their family's well-being or by the loss of family members as children? And then also, young children experience some of the COVID pandemic stress differently than adolescents. So I just wanted to share some of what has been seen nationally, and of course here too with youth, is higher rates of depression and anxiety, higher rates of grief, and also worries about, bringing home an illness and getting family members sick. Across the country, higher rates of children presenting to emergency rooms for mental health crises, including suicidal ideation or attempts. Behavioral changes, kids when they're, of course, stressed or anxious, depressed, they may kind of become down and sad and sink within, but a lot of kids, especially younger ones, also start having behavioral issues where they're acting out and being more oppositional. So that's been something seen. And then unfortunately, higher rates of substance use in adolescence, self-harm behaviors, and eating disordered behavior. And so again, we're just looking at, like, in general, increased numbers. And some of that may be in part that we're paying better attention this year as we're looking at, the pandemic effects, but also reflective of the stress. So I mentioned some of these pieces. We think about young kids, right? They may have a particular ability to understand COVID that's kind of, limited to their developmental capacity. And younger kids sometimes do better if their families are functioning well. Of course, if their families are really stressed, they can have a big a brunt of impact from that, since they're less likely to be able to control pieces or get space. But then teenagers, the teenage brain and adolescent development is really primed for social engagement. And so we know that isolation from this year has had tremendous effects on their mood, their anxiety, their functioning if they've been isolated from peers. The disruption in routines, the impacts on families, as mentioned, but also on school structure, and then the access to mental health care and child protective services, or at least people who are seeing if there are issues with trauma and neglect at home and reporting those, have all really been impacted this year. And then just to highlight that, we appreciate for kids that if they're in communities or families that have more support as far as emotionally or with additional childcare if needed, financially, spiritually, kind of the pillars that might be important for families and communities with kids, generally those children have been doing better as opposed to when the breakdown in those systems has happened. And then again, I just wanted to highlight at the bottom that we're seeing disparities too for children, based on racial and ethnic background, also socioeconomic identification of the family. And then for kids who are medically ill or disabled, it seems like they've also taken a higher hit this year, in part maybe because of anxiety about getting sick, or just being more limited than even their peers. So I have a couple slides here. Unfortunately, again, these were just pulled in the past few days. So this showing significant increase in kids presenting to trauma centers for non-accidental trauma, meaning abuse. And so really an increase in injuries that they're seeing during COVID, perhaps from kids being home. Unfortunately, like in New Mexico, there was initially a substantial decrease in CYFD reports, but that has shifted. And then just a couple other things we think about, right? If you consider all the different effects, right? You have parents who are struggling, they're using maladaptive coping patterns. Those are having effects on kids who are at home. So there's just been a lot of ripple effects. And then thinking about older individuals, I mentioned elderly here, but I mean, I think, right, just for people who are, in their older years, that we know sometimes the compounded isolation that comes with older age and losing more people, which often already again comes about as we get older, as well as even further limitations to accessing services, to being able to see family, and for people who have, less kind of ease with technology that's been the go-to during COVID, that there's just been more vulnerability in this population. However, when you look at some of the data, right, older individuals over 65 tend to be reporting less depression and anxiety compared to younger people during COVID. And so whether that's because with wisdom and experience, older individuals have more resiliency towards things like COVID, or kind of what the different factors are there, just to reflect some of the data that I shared earlier. And then a couple slides on healthcare professionals. I mean, working at UNM Hospital, I think we're consistently seeing the hospital is over volume, very busy, from COVID, but also from people that have been sick through this year and catching up now. And so a lot of healthcare professionals have been very stressed. They've been dealing with high levels of trauma and expectation. Associated with that stress, we're seeing increased reports of burnout, increased mental health concerns, and then unfortunately more people leaving medicine, especially in nursing and some other career fields, which is resulting in significant staffing shortages and thereby affecting healthcare delivery. So in New Mexico, then, just take a minute or two here. So definitely, as I mentioned, hospitals across the board in New Mexico are reporting increased demand for mental health care. So emergency services, outpatient needs, inpatient hospital beds for inpatient psychiatric admissions. And then through this year, there's been some expansion of services. I mentioned at the bottom, there's been more telehealth, remote services available, which has usually been good. But there's been reduced services, for example, for people that receive in-home care, that receive respite services for family members. And in general, really, the demand for mental health care has exceeded the supply and continues to do so at this point. This is some data I looked at with New Mexico for a Voice for Children in New Mexico, and this was taken from various surveys. But really, when you look at how children have been impacted, right, we know New Mexico is already a state with high levels of poverty, many children that are affected by trauma. And so when you look and think about the, downstream effects, if you have a lot of adults who are losing jobs, that means children in the home are going to be negatively impacted by the financial outcomes. Increased rates of food insecurity, basically 10% increase from 2019 to 2020. And then a lot of parents. So if 40% of New Mexican parents are reporting feeling anxious, stressed, or on edge, how that affects their kids. And we know most schools went virtual. And so a lot of the kids, were expected just to pick up with that, but up to 10% of our population doesn't have access to the technology the kids need. And a lot of kids didn't actually complete the school year last year. So, okay. So then just before we transition to conversation here, just to think about support for one another. So we usually try to encourage the process of, checking in with each other, checking in with families, checking in with people we care about, asking how they're doing, having conversations. I mean, a lot of times, right, people don't always want to go in depth on feelings, but I think just being present and supportive and acknowledging the stress of this year and validating it. These are some of the things we talk a lot with families about. Hopefully encouraging coping strategies for stress that are within people's means. So whether it's exercise, hobbies, other ways of building support and community, and turning some lens towards gratitude and, kind of positive perspective are all some of the maybe smaller things we have control in. From a bigger systems-wide support angle, thinking about how we support those that are grieving, how we acknowledge them. Some systems have started moving towards doing active mental wellness checks for employees or for students, kind of just to check in. But again, thinking about how do we expand the services mental health wise that we have between access, between numbers, or just what's actually available in terms of supply. How can we better support people from a peer level, from a community level, and within families? And so that's most of the data I had. I just wanted to kind of bring some of that up. I know it's, maybe not the most uplifting data to look at, but I think it's great in ways that there has been just a lot of growth in terms of considering how we can reach out and how we can better support people, and also just more awareness and acknowledgement of some of the mental health effects that have come about through the stress of this year. So yeah, I'm happy to field conversation, questions, feedback.
Well, thank you very much, Dr. Sowar. Excellent presentation with a lot of good information. And frankly, the statistics really sort of make me realize that it's much worse than, I had appreciated. I would like to ask one question, and that is, I really appreciate your focus on kids, because in the press and lots of other places, people aren't really talking a lot about kids. And, one of the things we know is there's this thing called the Adverse Childhood Experience Score. And New Mexico has always scored very high with that, and it correlates to poor outcomes for children. And it just seems to me COVID represents a whole new dimension in how you think about traumatizing children. And I wondered if you had any comments on putting that into perspective, especially prior historical things or other things you could think about that sort of help us get a feeling for what this generation that are kids right now are going to grow up into as a result of this experience.
Yeah, I think that's a really great question, and I'd certainly be open to other people's thoughts too. So I appreciate that you mentioned the ACEs, the adverse childhood events, and kind of what we've looked at historically with some of the impacts on children, ranging from violence in the home, substance use, divorce, abuse, neglect. I mean, there's a whole range, of course, of things that have been identified as adverse childhood events and how that affects people as they develop and grow in mental and physical health. So yeah, I mean, right. People have suggested like COVID, just being in COVID as a child more or less is an adverse childhood event. You just think about the different layers between kind of how kids have come to see other people as scary or as threats, right? Like other people might get you sick, and the distance you need to keep from other people, and kind of a heightened fear of germs that maybe historically hasn't been as strong. And then also just, I think as well, like the absorption that they get from household members in terms of stress and anxiety that many parents have carried. And then also recognizing, I know I didn't share the numbers, but, if we have over 700,000 Americans who have lost their lives to COVID, then certainly that's a lot of kids who have been affected either directly with a parent or grandparents or other relatives. So yeah, there is a lot of research kind of tracking at this point how it will affect kids. Various universities looking at that. I think definitely we're seeing some of the short-term effects, as mentioned, in anxiety and kids just lacking some of the typical outlets and having higher stress that, without great support will manifest into more serious things like suicidal ideation or self-harm. But I guess at the same time, honoring that, kids are pretty resilient. And I think sometimes we talk about, it's interesting, like some kids are so good at wearing masks, elementary age kids, middle school age kids, like they can be better at it than their adult counterparts, that kids can adapt. And I think a lot of their pattern of perception of COVID also is, kind of filtered through the eyes of their parents or the adults that are around them that help give some structure and support. So we do tend to focus in like mental health care for kids a lot around resiliency, and also I think trying to reinforce the positivity of social connection. But yeah, I think it's a great question, and unfortunately I guess time will tell to some extent the bigger effects.
Oh, thank you very much. Craig, I see you have your hand up.
Yeah, thank you, Tom. And thank you, Dr. Sowar, for your presentation. It was quite informative, if not, unfortunately, somewhat depressing, given the results, pun intended. I have a question about behavioral health treatment during COVID. I mean, prior to COVID, the lion's share of behavioral health treatment services were provided in person. And in fact, Medicaid would not reimburse practitioners for teletherapy prior to COVID. And of course, they changed that and we all went to mostly online teletherapy. I'm wondering if you are aware of any reports or findings about the extent to which teletherapy is or is not as effective as in-person therapy, and whether that changes with age, whether teenagers have a harder time with teletherapy, say, than older adults. Thank you.
Thank you. Those are great questions. Yeah, thank you for being present and bringing those up. So, right. I mean, you've raised some really important points that historically insurance providers have had resistance often towards moving to telehealth. Perhaps there have been areas such as for access to rural or more remote areas where it's been supported, but during COVID, of course, this explosive increase in the need for telehealth, and so systems really adapting. And yeah, many insurance companies moved over to a reimbursement model where they did reimburse for telehealth, and often in ways that were fairly equivalent to what in-person visits had been, although not consistently equivalent. I think, right, some of what we're seeing now too is that some insurance companies are starting to push back and not willing to reimburse for telehealth further, even if there's some suggestion that telehealth has been pretty effective. And so I know there's a lot of legislative campaigning and efforts by behavioral health, mental health providers to really try to keep telehealth alive as an option for people. I can share that at UNM, which is a pretty big hub, our numbers for our numbers for telehealth, like virtual visits during the pandemic, our show rates went up significantly. So we had very limited no-show rates for children and adolescents and their families, which was great. I think reflects that, connecting with youth who generally are more savvy with technology is a really great way to access them, and often more convenient for families than trying to get their kids and their whole family down to a clinic and out of school, and just kind of that ability. I think I don't have access, of course, to off the top of my head, all the data. Some of the studies I've seen suggest that a lot of adolescents and adults, kind of 20s, 30s, young adults, have reported really positive experiences with telehealth. And I don't know, I guess what I don't have is kind of clinically what they may have measured effectiveness with or benchmarks there. But basically continued demand and a lot of people continuing to request telehealth services. I think that some of the people that have been most affected are people with serious mental illness, chronic mental illness, like primary psychotic disorders, or people who really have significant impairments in their kind of social functioning and ability to advocate for themselves, that struggled with telehealth connections, either by not having access to it or not being able to navigate that system. So that's been a population that I think return to in-person has been really valuable.
Excellent.
Yeah.
Thank you, Dr. Sowar. We have a question on the chat I wanted to relay, and that is, what are the areas of effects that are qualitatively different from those in a non-pandemic economic downturn like 2008? So how did what we went through, because in recessions, there usually is an uptick in stress, depression, anxiety, and all those. So we've got some history on that, but COVID was kind of special because it was also a pandemic. Mm-hmm. Do you have a feeling for the contrast between 2008 and COVID?
I think, and again, I don't have some of the data right in front of me. I'm happy to look some of this up to share, but what I've understood is that comparing to prior, kind of societal economic experiences like that is that the degree of anxiety around kind of one's sense of mortality and the health related anxiety certainly has been tremendous during the pandemic comparatively. And so, with the economic downturns, of course, people have financial concerns, and there's the negative effects on households with regards to job security and kind of, all of the downstream effects from that piece. But I think there's this extra layer of health related concerns, and then the distancing from social connections that often tend to be good supports for us, even if we're in an economic downturn, people generally still feel like they can be with family or with friends, supports. And that's been, I think, a really difficult limitation.
So thank you very much. They're very insightful. I wanted to ask a different question, and because whenever we talk about helping other people be strong during something like this time of stress, we're usually talking about family members, coworkers, and people you interact with a lot. Mm-hmm. But, one of your charts showed that essential workers, who are typically people in checkout lines and law enforcement who deal with the public, are really under a tremendous amount of stress. How important is it for each of us to be able to work hard to sort of interact well with those people and support them, and maybe even get them to laugh a little bit, rather than sort of venting our displeasure at the whole universe at them?
Yeah, definitely. No, that's a really, I think, great point. Well, one of the things we know is that, acts of gratitude and appreciation can go a long way. And in ways that's common sense. There's also some reasonable data science behind it. And so, I think that's a big piece, is that a lot of essential workers, have had the stress and anxiety about their jobs, but then may kind of also be absorbing all of the anxiety and frustration from people that are around them and not recognized or always appreciated. So I think definitely, right, a little bit can go a long way. I know that there's also been movements, of course, looking at like minimum wage or wage considerations, just like the risks that people take by coming to work and how you can support them financially or with benefits. But yeah, right, as a society or community, I think those are great steps to think about how we can recognize those people that take good care of us.
Great. Is there anything specific that's coming out about how the pandemic is affecting people with serious mental illness, like a schizophrenia diagnosis or bipolar, severe depression? Is there, I mean, I'm sure people are looking at it. I just don't know if it's been published.
Yeah. Yeah. So again, I'm happy if folks share. I've seen some studies coming out recently that suggest, one, that people with severe mental illness are at higher risk of contracting COVID and then also developing more severe COVID. So as far as infection itself, that's part of it, right? And that's probably related to a lot of factors between kind of the general health and well-being of people with serious mental illness and also kind of things like their living situations and financial pieces and everything. And then, you know, I think also what's been seen is that generally people who have a history of anxiety disorders, especially OCD, obsessive compulsive disorder, have definitely had more challenges this year. I mentioned too, eating disorders, the numbers have really spiked for exacerbations of those. I don't think, I've not personally seen data about like people with schizophrenia and exacerbations in that regard, or bipolar. I don't know if that data has been done so much, but I would say within mental health, there's certainly an appreciation that for people with pre-existing conditions, they're at higher risk of increased stress from the pandemic.
Thank you. Now I want to put you really on the spot. Do you have any comments to make on the quality of medical leadership in the country through the pandemic?
That is a tough question. I know, right? And the pandemic's been a very politicized experience in a lot of ways. Well, I mean, I think that I guess what I would say is I think there's been a lot of efforts for people to do the best that they can. And I think a lot of people that work in the medical field and in healthcare have, you know, been going to great depths to put their minds together and figure out what can be done. I don't know that, of course, like, you know, in retrospect, maybe things could be done differently. But I do think that, you know, there's probably the biggest challenge has been how our emergency systems and our hospitals and some of those really acute care areas that are the catchment for everyone who needs intensive care, you know, kind of how they've been able to triage and take care of their healthcare workers and meet the needs of people. That's probably been the most complex area. But I guess what I hope is based on what we talked on earlier, that some of the evolution that's come about through the pandemic in terms of ways we can better meet people's needs, hopefully those are things that the healthcare systems can support, including wellness and, you know, insurance companies as well in terms of payer considerations.
Oh, thank you very much. I have another question from the audience, and that is, next month, our talk for this group is going to be a panel of crisis responders.
Yeah.
Our alternative response unit from the Santa Fe Police Department, our local Christus Hospital and their emergency department with its psychiatric care system, as well as the mobile crisis response team and our new La Sala Crisis Center. Do you have we learned anything through COVID that would tell us about how to present those or how to provide those emergency services for people in psychiatric distress better?
Yeah, it's a great question. So some states Often smaller states, for example, like Connecticut, or places that might have different funding sources, have really moved towards a delivery of care that's mobile crisis type service. So that's where you have, for example, I can talk a little bit about Connecticut in knowing some of the people that run their system. So they have a statewide service. They have a statewide hotline that basically, rather than going to 911, goes to sort of a 311 psychiatric emergency crisis line. They then have teams of mental health crisis responders situated throughout the state who are able to go to families or to individuals to meet them for mental health crisis. And they can usually do some triaging or intervention in the field, and hopefully arrange further follow-up for people if they don't need to be brought into emergency services. And that has been shown in many places to really reduce the need for emergency room service, and thereby reduce some of the burden on emergency services and keep people out of emergency rooms if they don't need to be there. So that's been one model that has been proposed. I think along those lines, as mentioned, the crisis center that's being built, and there are some being constructed down here in Albuquerque too. So crisis centers usually are better equipped to deal with psychiatric emergencies because they have the space or the goal of observing people or helping them detox as well, and sometimes doing more acute therapy, crisis intervention therapy. California has some areas that they've done a lot of crisis center focus, and that's again been shown to reduce the need for hospitalization. I think in New Mexico, with the question, I think the consideration for us is how do we mobilize the resources that we have? I think we've talked at UNM that if we could develop some degree of mobile crisis service in some of our bigger metropolitan areas, that could be a huge boost for the individuals there, as well as reducing emergency room need. And then as well as, I think improving the access of mental health consultation to emergency settings. The APD crisis intervention team here does a lot of mental health trainings. And so hopefully that being a part of law enforcement training statewide. And then I think the other big piece is just that we have really sparse outpatient services. And so we have people that come into an emergency room, and if they go home, they're waiting 6 weeks to see someone. There's not great follow-up in a short time, a lot of places. And so I think that's a major gap of how do we improve what's available to people that need sooner crisis care outpatient. So I know I don't have a magic wand. I think the biggest initial steps are considering how we strengthen our crisis centers and our connection with available services, as well as maybe trying to build some smaller mobile crisis services.
Wonderful. Thank you very much. And thank you for your presentation, the information you put together, tremendously timely information. And thank you especially for the focus on kids, because I really, I think of all the things I worry about it coming through this, it's just figuring out how we help the kids stay strong and, live the lives they have the potential to live. So on behalf of everybody at NAMI and all of our audience, thank you for a fantastic presentation.
Thank you. Thank you all for being here and for having me. It's really a privilege. Thanks for listening to me talk for a while. But yes, please, if there's anything from this, I'm always happy to be available by email or further contact, and I can share that too.